the CE mark, the entire European effort, if you will, was actually not something I planned at first. So when I mapped out the venture, I explicitly said we're not going to Europe. And I said, this is, we're going to stay in one market. We're going to the FDA. We have a lot of data to collect, a lot to spend on clinical study. So we're going to just focus on this and move it forward. NeoTract as a venture actually suffered from a sort of FDA trend that occurred. I will say for about 2 years, the FDA more or less shut down investigational studies. It was an unintended consequence of wanting to do it better, really. So the FDA set forth to say, hey, we're not going to start a study unless we know when the endpoints are met that it should be approved, because they were having issues with panels sort of denying devices going forward, even though they met their endpoint because they didn't agree with the endpoint and that sort of thing. It's a good goal, but the unintended consequence was they didn't start studies. It looked like our process was going to take 2 more years than we had originally mapped out. This was true of most startups at that time. This is in 2008, early 2009. And we were looking at that saying, we need to change our plan. We need to sort of mitigate this risk. We had 2 options. One was to drop back, let go of a lot of people, become a very, very low burn, small group, and just let the clinical data mature and then hire back up and enter into our plan later, which is a viable option. The other option is to say, how do we go to another market? How do we make the progress that we intended to make here and, in a way, learn everything that you need to learn to get into the commercial world, and also get some revenue coming in to help fund the company? We made that decision. And that was a big, big decision in our venture. That's also when I moved from CEO over to Chief Technical Officer, because part of that plan was, you know what, we should get a truly seasoned commercial guy in, or gal, to run the effort into the market in Europe. We hired in a new CEO. We decided to go after a CE mark. That was a year-long process. And the reason that's a year-long process is not because of, it's not because of the clinical data. It wasn't because of the data review. It was about having a truly commercial company. The difference I've found between FDA and the CE process is the CE process is really tuned to viable commercial companies, and their demands are those of a true organization ready to sell a product. FDA, you can get through an entire 510K process and not really be ready to start selling product. You're working on those systems. FDA will review that you have the right sort of processes in place to develop those systems. The CE mark process, looking for actual validating data that you have those processes. So you really have to be producing essentially a commercial product. And we moved our product into really what is very close to today's commercial product. We built out manufacturing. We did everything you do in quality to build a product you can sell and rely upon. And we did that, and when we entered into the CE process, it actually only took about 2 months, I believe, to get through that. The reason it was only 2 months is because we said we're not applying for a CE mark until we get to where we know we have to be. So it depends how you count it. You could say it took a year, or you could say it took 2 months.